Labour's 10-year NHS vision. Bold, radical, but isn't all too familiar. Labour has just unveiled a sweeping 168-page blueprint to overhaul the NHS over the next decade, advocating a shift from hospitals to communities, from analog to digital, and from reaction to prevention. 3 radical shifts at the core. 1. From analog to digital. The NHS app is set to evolve into a doctor in your pocket, enabling self-referral, appointment booking, medical record access, AI-driven consultations, and even ambient AI that listens during consultations. 2. Treatment to prevention. Fee focus will intensify on vaccination, early diagnosis, weight loss schemes, and restrictions on unhealthy advertising, aiming for a smoke-free generation starting with 16-year-olds. 3. Hospital-centric to community-based. Hundreds of new neighborhood health centers will offer diagnostics, mental health support, pharmacy, dentistry, and more, with care shifting out of hospital corridors. Here are the key components of the plan. The NHS app and unified records. By 2028, all patient data will be integrated in the app. Appointments, test results, past treatments, and AI-powered support. Hospital rankings. New league tables will publish hospital outcomes, wait times, and patient feedback to empower choice and accountability. Diagnostics and community health. Around 300 health hubs will open, community diagnostic centers will increase, and one-stop-shop local services will become the norm. The workforce strategy. Emphasis would be training new nurses, GPs, midwives, dentists, and community carers, shifting reliance toward UK-trained staff, integrated digital tools to boost efficiency, even aiming to reduce frontline staff numbers in the long term. Tech and genomics rollout. Free wearables in high-need areas, expanded genomic services, and AI tools to enhance clinician workflows. New patient rights. These include guaranteed same-day or 48-hour GP access, 1-week diagnostic waits, rights to talking therapies, home birth choices, personal care plans, and peer support. Public health measures. Targeted restrictions on sugar, salt, and fat in advertising, minimum unit alcohol pricing, defibrillators in public spaces, compulsory PE and sex ed in schools, mental health and children's health. An additional 8,500 mental health staff, young futures hubs in schools, supervised toothbrushing schemes, and digitized pediatric Red Book records. Lastly, the health inequality push. Billions of pounds will be redirected from deficit-strapped trusts to working-class and coastal areas. GP funding will be rebalanced to close the postcode lottery. What about funding, feasibility, and critiques? Budget boost. A £29 billion per year, 30%, uplift by 2029, plus a £2.5 billion time to care digital/staffing fund funded via mansion tax and tobacco levies. Infrastructure deficit. The NHS faces a £3.3 billion capital shortfall over the next 3 years, well below peers, and crumbling buildings, outdated tech, and fragmented systems. Staffing concerns. The BMA warns fewer staff in 10 years if digital doesn't deliver, and current GP pay/pensions/power issues could derail trust and buy-in. Unfinished business. Critics note that many programs mirror past plans from previous governments, for instance, digital neighborhood centers, prevention strategies, all of which have often failed to deliver. Public Health Week spots. Measures around obesity, alcohol, and unhealthy food advertisements are described as cautious and in need of bolder statutory strategies. An ambitious plan, yes, but execution is everything. The plan has been praised as visionary, modern, and overdue, calling for reform or die, if Labour's NHS is to reclaim trust and sustainability by 2029. Its success hinges on capital investment to repair NHS infrastructure, workforce collaboration to prevent staff disillusionment, robust digital rollout to ensure usability and security, bold public health interventions to preempt chronic disease. As the King's Fund puts it, transformation depends on making care closer to home a reality, not just theory. Overall, Labour's 10-year health plan is undeniably bold, a digital-first, prevention-heavy, community-anchored vision that resonates. Yet in its familiarity lies risk. Decades of similar initiatives have stumbled without infrastructure, funding, or workforce backing. As Mr. West Streeting and Sir Keir Starmer pledge reform, the final verdict will rest on delivery, not aspiration.